gentlemen. I'm here to give an advice to the whole world and the entire country on how to give a good treatment to the people of the joints, people that have the joint problem. Nigerian doctors and pharmacists are making some errors in their profession in the area of joint pain, in the area of treating joint pain. In Nigeria, while in the Indian doctors, in the Indian countries, they treat the joint pain as a common cold. Now, let me talk about the pain of the joints. Let me talk about the joints. Now, when we talk about the reason why I'm saying this is that the doctor should provide good facilities and main doctors are qualified to give the patients good quality treatment and cure to relieve fast pain and to not give them difficulties. Now, let me come about why I said this. The Nigerian doctors, the Nigerian treatment, they only give patients treatment to cure the pain only. But after some moments and minutes or days, weeks and months, the thing will come back. The pain will return back. But this one, it will be lesser. But that's the disadvantages. It will come back later, but it will stay. The period you take that drug, it will stay. But when you stop taking the drugs, it will return back. Now, let us go to the Indian doctors. The Indian treatment, the India managed to obtain what they called quasi vitamin B. Those are for this the joints, treating the joints and the pain there. So let us talk about ultrasalt. Ultrasalt is a root cause of pathologies. Pathologies is a disease affecting the joints and other. Since we're talking about joints, we'll say it's affecting the joints. So pathologies and astrosalts. Too much of ultrasalt can lead to the joint break and joint pain. If you take too much of ultrasalt, when you want to stand up, it will not give you free movement. It will hold your body like permanent stay. You will not be able to walk well. Your bones will be scattered. So let us talk about the ingredients inside the quasi vitamin B. We have the ingredients inside there that is the synthetic ingredients. We have the snake venom. We have the marrow antler. So let me talk about the amara antler. Mara antler in the animal science is what gives activate growth of the animal horns, while in the human body it creates new bone tissue. So now my advice to Nigerian doctors and governors that they should provide good facilities and equipment to treat the Nigerian patients of the joints, and they should also bring a qualified doctor. This is not a matter of joke. It's a qualified doctor, because the issues now that's occurring nowadays is of the joints. People are suffering of back pain, strain, all those things, and the causes of the joint pain is too much of stress. When you stress yourself too much, you get the joint pain. And also, if they didn't give the good qualified doctors, it may lead to they will have the joint pain. And also, they should bring good qualified equipment. Let's now go to the doctor. Let's now go to the area of normal science. If a patient cannot breathe, they need to get a ventilator. If the patient now comes to the hospital and does not have and they don't have a ventilator, the patient can easily die. And that is what is causing common death now in nowadays societies. They don't have ventilators in the hospitals. They don't have what they use to breathe. Oxygen they don't have. So that's why we encourage the governors and doctors outside there to able to know what's the next step and right to take. If they don't know what to use, they can go on the search and goggles. And also the equipment used is, if you want to prevent it, you can use what they call Astarex. That's the drug used for the joint pain. Thank you so much. God bless you. Thank you for listening to this channel. If you want any information, don't care whether I'm small or big, I'm here to give you the knowledge of education of the joints. You can ask any question online. Subscribe to this channel. Jesus, God loves you. Bless you.